Saida is the third largest city in Lebanon and is located directly on the Mediterranean coast, 40 kilometers south of Beirut. The name Saida or Sidon is translated to mean fishing town. It was one of the most important Phoenician cities, and it may have been the oldest. During Phoenician times, glass manufacturing was very important, and so was the production of purple dye from small murex shells that were so rare that it became the mark of royalty. If you come visit Saida, you will find the ancient temple of Eshmun at the entrance of the city. Eshmun was the Phoenician god of healing and renewal of life. The temple was built near a spring whose water was thought to have healing property and therefore was sacred. So health and healing had been part of the city of Saida from its origin. Batul is 9 years old and lives in the old city of Saida. Today is not like any other day for her. She is very excited. She wakes up early, gets dressed, helps her mom, and prepares herself to go to school. She knows that a nice surprise is waiting for her, and she's very happy. On the way, Batul passes by to pick up her friend Wadia. But before leaving, Wadia wants to drink some water. But is this water safe?
حسن شعبان صياد بالبحر توصل لعند المي بس مش قوية كتير وبتيجي كتير معوكرة يعني أنا بحسها منا صالحة للشرب بس شو بدنا نعمل؟ بنضطر نشرب من مية الحنفية.
لا أنا أول ما خلفتهم أغلي لهم مي وبس تبرد بسقيهم منها بس كبروا عادي خلص من الحنفية.
Water is an essential human need, but for humans, water also means clean water. Polluted water isn't just dirty, it's deadly. Approximately 1.8 million people globally, mainly children, die each year of diarrheal diseases. Water preservation is a necessity, and access to clean water is a human right. Batul heard there's going to be a special event at school today with a group of doctors and nurses from a local hospital. They are coming to talk to them about the importance of hand washing. She is hoping to play with some soap, water, and sing songs with her friends. The aim of the campaign is to raise awareness about hand washing in all the schools of Saida. Hammoud Hospital University Medical Center is the largest hospital in the south of Lebanon and has been training doctors and nurses for the past 30 years. One of its missions is to improve the health and well-being of the diverse communities they serve. Over the past couple of years, the hospital has increasingly become more involved in community awareness. Campaigns such as diabetes, hypertension, and flu vaccination.
This year I decided to look for a word that I can implement in all my work on the corporate level, the hospital, and on the private level. The word should be related to change and transformation. It is an alignment of where the hospital is right now after a turnaround that started in year 2014. And most importantly, it should be a unique transformation and a change after 50 years into this organization.
This year, the hospital will focus its community outreach efforts on the role of hand hygiene in the prevention of infectious diseases. Clean hands will keep people healthy, reduce infections, and hence reduce antibiotics usage, which is a major factor contributing to the worldwide problem of antibiotic resistance.
The first day of the year, I was watching CNN Heroes, and I was just inspired when I saw Samir Lakhani, who was able to do a grand change in so many lives with a simple act of a simple soap.
Everybody knows that recycling is important. What people don't realize is that there are bathroom products which can also be recycled. In the United States alone, 2.6 million bars of soap every day are thrown away by the hotel industry. So I set out to do something about it. My name is Samir Lakhani, and I turn hotel waste into a life-saving resource.
I was traveling to Cambodia a few years ago, and I heard over there the story of this young man, Samir Lakhani, who is doing this, and I found the idea absolutely fantastic and so basic and so easy and so practical and so evident, but nobody thinks about it, that I kept this in the back of my memory.
I was inspired with the idea. I came back to the hospital. We engaged in several sessions of discussions what to do, how to use this, and we realized that hand washing is a critical tool in our everyday life in the hospital. This was the perfect start to do the hand washing campaign, صحتك بإيدك, to teach the community, to share our knowledge from the hospital to the community, to simplify the clinical aspect of washing hands into simple terms, into the community, to the children, and they also can be the agent of change or the heroes of our community.
برافو. طب أنا هلا حزيت صابون وحغسل إيدي منيح هلا عم خدوا هيك كأنه عم نغسل إيدينا. شوفوا شو صار عنا. راحوا. بطلوا مكبتلين الجراثيم مع بعض.
On a micro level, the work started. Engineering department started creating a mobile machine, which is a sink, a water container to provide clean water when we go to schools and teach the children how to wash their hands.
مثل ما لاحظتوا الصابون مع مي بيلقط كل شيء فيه وسخ بياخدها معه، اوكي؟ بس ما بيقدي واحد يغسل بس بالصابون ومي، لازم يغسل كل المحلات على ايده حتى نروح كل الميكروبات، ولازم نغسل لنص دقيقة.
The Audi Foundation, the soap factory, gave us soaps to distribute in the schools while we're teaching them. The nurses and the doctors started creating slogans and ideas and songs, how to approach children and show them the criticality of hand washing. And this is where our mission started. Our objective is to reach as much as we can from the community, displaced, and our Saida community. From that point, the team, about 20 volunteers and more, nurses, doctors, engineers, everybody in their own forte, started building up the concept of our campaign. They wanted to go further. They wanted us to go into the community and do a one-year campaign of hand washing teaching to the kids in the schools.
My drive to join this campaign, Your Health is in Your Hands, صحتك بإيدك, was to make people more aware, especially children, about the importance of hand hygiene. As a doctor, I know the importance of keeping our hands clean for the safety of our patients.
We as surgery residents, doctors, and even medical staff, we clean our hands before going to the operating room and after leaving the operating room, and even after we visit each patient on its own. Probably one of the most important things is to keep our good hygiene to prevent transmission of diseases and infections and keep our patient in really good health.
I joined the campaign of Your Health is in Your Hands because I get really attached to my pediatric patients at ICU, and I believe that hand hygiene is at the core of infection control and disease prevention. So I really believe this campaign would contribute greatly to keeping children away from diseases and keeping them away from ICUs.
I'm passionate about music, so I liked very much this campaign of hand washing. Your health is in your hand. And I helped writing and preparing the song for this campaign, صحتك بإيدك. I'm also a mom of 3 boys, and they're messy. They play a lot in dirt and all things like all children. So this theme is very important to me. It touches me as a mother to protect my kids from catching illness.
I am one of the organizers in this campaign, Your Health is in Your Hands. We as volunteers, we are doing a training session to be able to teach students we are visiting in school how to wash their hands properly. I am part of a larger group that usually do and organize an awareness campaign in Hammoud Hospital, and I really enjoyed this time doing this campaign, صحتك بإيدك.
We tried to figure that how is it the best channel to create this change and this prevention. Of course, it was through schools.
Hand hygiene is as important in the community as it is in the hospital. This is why Hammoud Hospital launched the hand hygiene campaign entitled صحتك بإيدك, or Health is in Your Hands. The teaching session is interactive, using science to introduce the concept of the microbe that causes infections.
أنا طبيبة التهابات جرثومية. شو معناتها؟ يعني إذا واحد عنده إسهال، صار عنده سعلب، بعطيهم دواء التهابات، أوكي؟ أنا ما بحب شوفكم مرضى أبداً.
كمان اليوم بدنا نتعلم كيف نغسل إيدينا، ولازم نعلم أهلنا كيف نغسل إيديهم حتى ما ينعدوا بأي شيء، بأي مرض.
Through role play with the children and using glitter to represent microbes, the kids are learning about how easy it is to transfer germs from hand to hand. Fun sketches discuss the importance of washing your hands before eating, after using the bathroom, after playing outside with their pets, and after coughing. Microscopes and petri dishes are brought to the schools so kids can see what bacteria look like. Jars filled with oil and glitter, representing dirt and germs, are mixed with water and then compared to a jar where soap is also added. This reveals to the children why soap is the best way to clean and eliminate dirt and germs. The kids see how soap disperses dirt and microbes and how you can rinse them off.
Hand hygiene is one of the simplest activities we can do for our health. And unfortunately, the compliance with hand hygiene is not at the level we need it to be. It is one of the most vital activities we can do for wellness, child development, as well as cutting down on the number of illnesses in the community and the use of antibiotics.
I participated in this campaign in the first place for the sake of the kids, to teach them the importance of hand hygiene and to teach them the proper ways in simple hand washing techniques.
The session ends with an original song in Arabic that was written and composed by hospital staff. It is used as a reminder to the children to always wash their hands for at least 30 seconds.
تبقى الصحة بإيدك، الجرثومة بتهرب لبعيد والأمراض عنك بتحيد، القوة بجسمك رح بتزيد وصحتك رح تبقى بإيدك.
وظهر وعشية لما رح تغسل ايدك بالصابون والمي، هالخبرية اللي بتفيدك قبل الاكل يا خيي، بعد اللعب بتعيدك طول وقت الغنية، رح تبقى الصحة بايدك، جرثومة بتهرب لبعيد والامراض عنك بتحيد، قوة بجسمك رح بتزيد صحتك رح تبقى بايدك.
صحتك بايدك، صحتك بايدك.
I'm a mom and I decided to join this campaign to target schools to help children and explain to them how to wash their hands to stay healthy. I was very happy to see the children in the schools, how they interacted with us. They asked a lot of questions and they enjoyed with us singing the song and learning how to wash their hands.
To retain the lessons learned, all the children were given personal soap, a box of coloring pencils, and asked to participate in an art competition where they submit a drawing related to what they learned.
I decided to join this campaign in order to emphasize on the fact that hand washing is very important and doing it right is also important. So we're teaching kids and children in schools, public and general schools, to learn the basic steps of hand washing and the time that they're supposed to wash their hands for, in order to make sure that we're keeping all the bacteria and all the germs away and to keep them in a very healthy environment.
Our slogan is "Your health in your hands." I'm very happy that I'm part of it because we're giving awareness for kids, especially the grade 4 kids. They are around 10 to 11 years old, on basics of proper hand washing, and it's all related to health and diseases.
We feel that if you build a habit, it is with you for life. Even though people know how to wash their hands, they've had the lessons, unfortunately, most people do not participate in that simple habit for their health.
تعلمت كيف بيصابونوا ايديهم منيح، كيف بنلقط ميكروبات وشو بيساوي الميكروبات. نتعلم كيف نكون بصحة منيحة نحن عم نغسل ايدينا.
And it just happened, it's an alignment to that. The first Rotary presidential conference is taking place in Lebanon, and their slogan is about inspiration as well and health, providing clean water. It fit perfectly together. The hospital decided to engage and be sponsors of the workshop and work with the community through the presidential conference, but not only that, also on the community level. In order to do that, we started also working with the Hammoud Foundation, which is also from Saida, again from the community, giving to the community.
I felt that this campaign would fit perfectly with the objectives we have at the Hammoud Foundation and the Soap Museum in Saida. It's a heritage, it's the patrimony of a lot of people, and it's how we realize that in fact a lot of people, when you have some olive trees, you have olive oils and you make your own soap.
The story of soap started here in this region, which was my hobby. This hobby, it turned into a small business through متحف عودة, through Audi Museum. It's your passion and what you are doing.
We want to do things for people, for the societies, especially children. And I am very much into education. It was exactly in the idea of what we want to have with our contact with the population in Saida and around, and especially these young persons.
I am part of this campaign. I'm proud to be a part of it. We are trying to encourage and to spread awareness among young generations, to encourage them to go back to use natural ingredients, which soap is among these products. It's a very natural product made of natural oils, far away from chemicals and colorings and whatever hurt the health.
The volunteers visited a shelter where more than 1,000 displaced people from Syria live. They are living in very difficult conditions with limited access to clean drinking water and proper sanitation facilities due to overcrowding and a host of other factors. Visiting children living in the shelter was just as much of a learning experience for the staff as it was for the group of kids that attended the session. Our aim in the hospital is to prevent illness in our community. If our campaign prevents even one hospitalization, it's a success.
تعلمت إن الصحة كيف نغسل إيدينا كرمال ما يمرض وكرمال يحافظ على إيديه كرمال النظافة. تعلمنا إنه نغسل إيدينا مظبوط والنظافة.
What we're trying to do here is catch up the educational gap that the children have because of the lack of schooling they've had because of the war. Hygiene is really important for us. No matter what environment you're from, no matter what country you're from, hygiene is the same everywhere. So what we do with the children here, like we would do with any children, is teach them about hygiene, proper hygiene, and how to keep clean. Here the water that they use is largely clean water. The lack is just about knowledge, how to properly clean hands, how to properly use the soap to have the best possible results.
It was very positive to see that all schools we approached in Saida were more than interested to do this campaign with us because they knew we are teaching good habits to the children and they will take it into their communities and their homes. In the end, our objective is, as a hospital and as a small community that represents with our employees the community of Saida, we wanted to create a sustainable change. It should start with the know-how we know, washing our hands, distributing the soap to the communities, teaching the children how to use those techniques, becoming heroes, and then them going to their schools, to their communities, to their homes. It's a chain of change. We just started it somewhere, just like the soap, just like the bread. We break it, we give each other, and it continues, hoping that diseases are less and prevention is taken seriously at all levels.
To celebrate the first phase of the campaign, a city-wide hand-washing day was organized. A large piece of soap was divided in the hospital lobby and sent simultaneously to all the schools that had participated in the hand-washing classes. The event's goal is to remind us all that communities thrive and can achieve wellness when all sectors of a society work together. As in the African proverb, it takes a village to raise a child. It took a group of healthcare workers to help teachers and parents teach children that their health is truly in their hands.
Okay, volunteers, بدنا نبلش الكاونت داون. وصلتوا كلكم شايفتكم كيف الأولاد محمسين. نحن سوا على 12 مدرسة بالمستشفى هون كلنا situation room رح نبلش نغني مع بعض صحتك بإيدك لحتى نخلي صيدا صحتها قوية.
سبحان الله العظيم لما نحن نستفيد